Hospitals are struggling not just on their front lines, but in their bottom lines. Revenue is way down, with routine visits and elective procedures postponed. So you can imagine how much worse it can be for rural hospitals. Those include facilities in Virginia, with cases there nearing 900. They are bracing for a major surge in COVID-19 patients. Hospital administrators are fearing shortages in staffing, in supplies, and in cash. NBC's Deepa Shivaram is in Charlottesville, Virginia. And Deepa, how prepared are these rural hospitals for what could be a surge in patients?
That's a great question, Joshua. This is a really unique problem for some of these facilities in these rural hospitals here in Virginia and other rural parts of the country. I've been speaking with folks in Idaho and Wyoming, here in Virginia as well. And the crisis that they're bracing for has led to some creative problem solving, you could say. I spoke with a hospital CEO down in Wise County, Virginia. They only have about 40,000 people living in their county. And of their 3 hospitals, they've actually decided to just pick one as the designated COVID-19 hospital. And that's in an effort to keep the other 2 hospitals running normally and trying to see as many patients otherwise as they can. And so some of these creative problem solvings, including trying to access telehealth, increasing those services, are what people all across the country in these rural areas are aiming for. I actually want to play you a piece of sound, though, from a CEO of a really rural hospital I spoke with in Idaho, and he kind of describes the situation that they're facing. So take a listen to that.
A lot of small hospitals, they may have 15 to 20 days cash on hand. They're trying to make the payroll when things are good. And being asked to lay out all this additional expense while at the same time enacting infection control measures that limit regular operations. Hospitals of our size are always in jeopardy of closing, but this coronavirus is taxing us to the absolute limit.
So Joshua, you can hear right there how dire the situations are for some of these rural facilities, talking about how, they're making their paychecks on a good day. And so it really speaks to the larger question here of the rural health crisis that we face in this country. There's over 100 rural hospitals that have closed in the last 10 years. And I spoke with a number of folks who told me, no, it is not an exaggeration to say some of these facilities will shut down at the end of this public health crisis. They're really facing a shortage of cash, a shortage of supplies, and in addition, a shortage of doctors as well.
Yeah, Deepa, as if rural hospitals didn't already have enough to worry about before coronavirus, and heaven knows what this is going to do to them after this outbreak is over. Thank you, Deepa. That's NBC's Deepa Shivaram reporting from Charlottesville, Virginia.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.